Princess Catherine's cancer diagnosis shocked the world and posed countless questions. Now, thanks to the input of medical professionals, we're a little closer to learning the answers. Princess Catherine is remaining tight-lipped about her cancer diagnosis, as is her right. Given that we know she's receiving preventative chemotherapy, however, do we at least have a decent idea of what type of cancer she might have?
The surgery was successful. However, tests after the operation found cancer had been present.
Ben-Ho Park, MD, told Today that while it could feasibly be any type of cancer, the major abdominal surgery Catherine had prior to the discovery of her cancer hints that it might be genital, gastrointestinal, or urinary. Aditya Bardia, MD, MPH, told Everyday Health that colon and breast cancer are often treated with preventative chemotherapy after the surgical removal of tumors. Still, despite the fact that we know Catherine had abdominal surgery, we don't know much else, making it hard to guess what cancer she might have been diagnosed with. Andrea Porpelia, MD, told Everyday Health that abdominal surgery is a pretty common treatment when it comes to removing solid tumors. She said, "There are too numerous possible cancers to list them all." Princess Catherine's type of cancer might still be a big mystery, but one thing that's a little clearer is how advanced it may be. Speaking to Everyday Health, Andrea Sursek, MD, said that preventative chemotherapy isn't a common treatment for stage 1 cancers, which means that Catherine's cancer had likely progressed past stage 1 by the time doctors discovered it in January 2024. Speaking to Time, Jeremy Jones, MD, explained that preventative chemotherapy can be prescribed under various circumstances. That said, it's usually only highly recommended for cancers that are in a later stage and have a high chance of coming back in the future. Catherine Van Loon, MD, told the outlet, "It is prescribed if there is some concern based on the pathology of the tumor or the patient's clinical history to suggest they are at risk of the cancer returning in the future." She added that doctors might prescribe this treatment when they are being ultra-conservative, which is usually the case with younger patients such as Catherine. This means that Catherine might have stage 1 cancer and her doctors are simply overly careful, or it might mean that her cancer is pretty aggressive, was in a later stage, and has a high risk of recurring. It's worth knowing that preventative chemotherapy isn't a technical medical term. As Catherine Van Loon explained to Time, doctors refer to it as adjuvant chemotherapy, and according to Ben-Ho Park, it exists to kill remaining cancer cells. He told Today, even though the surgeons have removed everything they can see, there could still be cancer cells floating around in the body that, if left untreated, may come back later and are then incurable. Teresa Werner, MD, perhaps described the treatment best while making an appearance on the University of Utah's Health Library podcast.
The point of that chemotherapy is to eradicate any microscopic residual cells to prevent recurrence.
While the name of the treatment is a little misleading and indicative of chemotherapy used to prevent cancer altogether, Werner made it clear that it's not the case.
They're not preventing the cancer in the first place, they're preventing a recurrence. And that's why she's getting chemotherapy, I think.
Andrea Sursek describes preventative chemotherapy as an insurance policy. Referring to Catherine's surgery, she told NBC News, "The surgery was successful, and that's the most important thing." Preventative chemotherapy isn't just one type of treatment. It can consist of various existing cancer treatments and often depends on the patient's diagnosis. Radiation therapy, hormone therapy, immunotherapy, targeted therapy, and traditional chemotherapy can be used. Radiation therapy can be administered in 2 ways, either by radiation machines, which direct beams of energy to parts of the body affected by cancer, or through a radiation source that's implanted into the body at the cancer source. The latter is referred to as brachytherapy. Hormone therapy, meanwhile, works to either block or remove the cancer-causing hormones in the body, which can inhibit the growth of cancer cells. Immunotherapy, on the other hand, works in tandem with your immune system to destroy cancer cells. This treatment helps the body identify cancer cells and kill them. Targeted therapy works by attacking cancer cells specifically by targeting the chemicals found in these cells. As these chemicals are blocked, the cancer cells start to die. Chemotherapy, one of the most common treatments for cancer, is given either intravenously or orally. Various chemotherapy medications exist, but they all have one thing in common. They are strong drugs that kill cancer cells throughout the body. Princess Catherine has been undergoing preventative chemotherapy for a number of months now. She hasn't shared how long her treatment will last, and according to doctors, the duration of preventative chemotherapy can vary greatly depending on what type of cancer is being treated, as well as the type of treatment being administered. As Jeremy Jones told Time, studies have shown that giving anywhere from 3 to 6 months of chemotherapy after surgery can significantly reduce the risk of cancer coming back. It's standard of care to reduce the risk of recurrence for many types of cancer. Given that Catherine's cancer treatment started in late February 2024, there's a chance that she might finish treatment treatment in August 2024. Of course, treatment can sometimes take longer depending on a couple of factors, like how well your body responds to the treatment, the time it takes for you to recover between chemotherapy cycles, and how severe the side effects are that you experience. If sources who spoke to Vanity Fair are to be believed, Catherine is responding pretty well to treatment. A source told the outlet in May that the princess had turned a corner. They said, "It has been a great relief that she is tolerating the medication and is actually doing a lot better." The reveal that Princess Catherine was receiving preventative chemotherapy led to confusion among many that chemotherapy can somehow be used as a preventative measure to keep people from developing cancer in their lifetime. However, this is not the case. Speaking on the Health Library podcast, Teresa Werner explained that you can't simply walk into a doctor's office and ask for preventative chemotherapy.
To give a healthy person who might have a chance of cancer chemotherapy would not be done, and that would cause a lot of side effects.
Chemotherapy targets rapidly dividing cells, but many healthy, normal cells in the body divide rapidly, such as those found in hair follicles and inside the mouth. This is why chemo patients often lose their hair and develop mouth sores. Additionally, giving someone who has never had cancer chemotherapy treatment likely won't do anything to prevent cancer from occurring, even if they are at high risk of developing it. Body language experts say Princess Catherine exhibited some signs of stress over her cancer treatment when she shared the announcement, and who can blame her? Chemotherapy is known for its slew of nasty side effects, and Catherine still has 3 young children who depend on her. Derek Sang, MD, however, told Breakfast Television that despite all the horror stories, some people respond well to chemo.
Depending on the specific type of chemotherapy given, sometimes the body tolerates it extremely well.
It seems like Catherine might be one of the lucky ones. When she made her first public appearance in June 2024 for King Charles III's birthday celebrations, she looked pretty well. The royal was seen laughing with her kids and grinning at the public as she waved to them during a carriage ride. Prior to the king's birthday celebrations, Catherine took to Instagram to share an update on her health and the little things that help keep her head up. She wrote, "On the days I feel well enough, it is a joy to engage with school life, spend personal time on the things that give me energy and positivity, as well as starting to do a little work from home." Despite appearing to handle chemotherapy well, Princess Catherine said in her Instagram post that it hasn't all been easy. She wrote, "There are good days and bad days. On those bad days, you feel weak, tired, and you have to give in to your body resting." Derek Sang says these symptoms are on par with most chemotherapy treatments.
It can cause general symptoms like fatigue, sometimes some nausea, sometimes some gastrointestinal upset.
Tara Narula, MD, added that lack of appetite, infections, bleeding, bruising, and vomiting are among the other side effects Catherine might be dealing with. When it comes to long-term side effects, Narula told Today that Catherine might be facing challenges related to cardiovascular and organ health. The royal's young age is definitely a plus, but Narula made it clear that chemo can be tough no matter how old you are. And while preventative chemotherapy might sound less serious, it isn't when it comes to side effects. She said, "This is not a walk in the park. When we say the term preventative, it sounds light and fluffy, but she may be going through a lot this time." Royal expert Katie Nichol echoed the sentiment when she spoke to Entertainment Tonight, saying that Catherine's appearance at Trooping the Color appeared to take a lot out of her.
For everyone facing this disease, in whatever form, please do not lose faith or hope. You are not alone.
Given that Princess Catherine is receiving preventative chemotherapy, there are some lingering questions as to whether or not she actually still has cancer. According to doctors, it's impossible to know. Speaking to Today, Benho Park explained that patients who receive preventative chemo are sometimes already cured of cancer after surgery, but doctors can't tell for sure, hence the treatment. In other instances, undetectable traces of cancer can still be left in the body even after treatment is completed. Park admitted, "In truth, we overtreat patients every year because we simply don't know if they still have cancer. A lot of patients get chemotherapy when they're probably already cured." Park added that there's always uncertainty when it comes to cancer and its treatments. Unfortunately, there's no way for doctors to be 100% sure that the cancer won't return in the future. Given the uncertainty when it comes to the efficacy of cancer treatments, how effective is preventative chemotherapy? Well, it depends on a variety of factors, including the type of cancer. A 2017 study published in the Journal of the Lancet Oncology found that patients with stage 2 or 3 colon cancer had a reduced risk of mortality and recurrence by 20 to 30% after receiving preventative chemotherapy. Most doctors seem optimistic about the treatment, with Jeremy Jones telling Time that anywhere from 3 to 6 months of chemotherapy after surgery can significantly significantly reduce the risk of cancer coming back. However, it still depends on the type of cancer, since some are more responsive than others. Beth Carlin, MD, agreed with Jones's explanation, telling Time, "There is a lot of evidence to support adjuvant chemotherapy impacting overall survival and allowing patients to live years longer and perhaps even affecting a cure." She added that Catherine's doctors are clearly doing everything in their power to ensure she can live the rest of her life cancer-free. Princess Catherine's cancer diagnosis was a huge shock, in part because of her age. She was only 42 at the time of her diagnosis, which is not an age generally associated with being at risk for cancer, let alone being diagnosed with it. This sheds a light on a very concerning matter that has puzzled doctors for a while: an uptick in cancer among young patients. Fola May, a cancer researcher at UCLA Health, told the Washington Post, "It's not only older people anymore. We need to focus on the messaging that young people need to be aware they are also at risk. Women in particular need to be more vigilant, since studies have found that breast, endocrine, and gastrointestinal cancers have increased among younger women by 15% between 1990 and 2019. Gastroenterologist Joel Gaber, MD, suspects the environment has something to do with the increase in cancer among young adults, while lifestyle factors like smoking, obesity, and alcohol are also thought to be contributing factors. Family history also plays a part, as well as existing diseases that could predispose people to certain cancers. However, Gaber noted that he's been diagnosing a lot more young people with colon cancer, of whom many don't have a family history of the disease.